This is Mrs. Reichelt, and we are continuing on our discussion about the appendicular skeleton. Specifically, this video will talk about the bones of the lower appendicular skeleton, so the pelvic girdle, and then also the bones of the leg. So the pelvic girdle is formed by the two coxal bones, and it's composed of three pairs of bones that are fused. So those are the ilium, the ischium, and the pubis. And we'll actually look at some pictures of these coming up. Okay, so the total weight of the upper body rests on the pelvis. So it has to be very strong, and it's going to act as a protectant as well. So the pelvic girdle protects several organs, including the reproductive organs, in addition to the urinary bladder and other parts of the large intestine. Okay, so here's our diagram, and I think that there's a picture of this in your study guide, so if you want to take that out and you can start labeling things, you may want to pause me and label some things first. So first of all, here we have the iliac crest. Then we have the sacroiliac joint, or the sacroiliac. I know you don't like how I say sacrum, so sacrum. Then we have the pelvic brim as well, the ischial spine, which is right here, okay, the acetabulum, which is this notch right in here, and then the pubic symphysis, which is this area. Okay, then we have the coccyx, the sacrum, and then again the ilium is this large bone, pubic bone is right here, and the ischium's right here. Okay, so there is a whole bunch of writing on this slide. Do not feel like you have to write everything down. We're just going over the major differences between the male and the female pelvis. So the female inlet is larger and more circular. And if you want to write a couple of these down, that's fine. You don't need to write all of them. The female pelvis as a whole is more shallow, and the bones are lighter and thinner. Hopefully that makes sense. The female ilia flare more laterally. The female sacrum is shorter and it has less curved areas. The ischial spines are shorter and farther apart in females, so the outlet is also larger. And then the female pubic arch is more rounded because of the angle of the pubic arch is greater. So there's a whole bunch of words here, but I think when you actually look at the diagram, it's pretty obvious. Okay, so we have two different pelvic bones here, or what do you think? Male or female? Which ones? So hopefully you're saying male over here and female over here. So I know that there was a lot of writing, but in the end, make sure you're just able to really look at them and tell the difference between the male and the female. Okay, so the bones of the lower limbs. So we're getting into the femur. Looks like we're going through first. So the femur, better write that down here. The femur is the heaviest and strongest bone in the body. Okay, go ahead and find the picture of the femur in your study guide. Pause this and write down all of the bone markings that we'll spend a lot of time reviewing. So we have the neck of the femur. Go ahead and just write all of these down, and then we're actually going to talk about each of them in detail when we're in lab. So we're not going to spend lots of time on this right now. Just go ahead and pause it and write everything down. Then we're moving down to the lower leg. The lower leg has two major bones. The first one is the tibia. The tibia is known as the shin bone, so it's this bone right here. That was not a very good outline, was it? So we have the tibia, then we have, oh, by the way, the tibia is larger and more medially oriented. And then the last bone here is the fibula. Okay, the fibula is thin and stick-like. Go ahead and pause me and write down all of these terms as well. And then next up, we have the foot. So the foot is made up of the tarsals. The tarsals, there are two large bones here. The calcaneus, which is here. And then we have the talus, which is here. And the calcaneus makes up the heel bone. And then we have the soles, or the metatarsals. And then we have the phalanges, which are the toes. Then the arch of the foot. Okay, so the bones of the foot are arranged to form 3 strong arches. So you see the 3 strong arches. You have 2 longitudinal arches. So the medial longitudinal arch, okay? You also have the lateral longitudinal arch, and then you have the transverse arch. So just be aware that you have arches in your foot. And that wraps up the rest of the appendicular skeleton.